So the next question that comes up is, why do I feel the way I do? The answer is due to sleep fragmentation. We think that if we get 8 hours of sleep, we might reasonably expect to feel refreshed when we wake up, but not everybody does. I will tell you that in regards to signs and symptoms of people with sleep apnea, some are not overweight, some do not snore, some don't feel tired. But many people do wake up and feel unrested and chronically fatigued or sleepy all day. This can be due to the sleep fragmentation. It has to do with the stages of sleep. When we sleep, it is not one thing through the whole night. It runs in cycles of 90 to 120 minutes, and during that time we go from awake like we are right now down into deeper stages of sleep. While we are awake, the brain tells our lungs how deeply and often to breathe. It also tells the muscles that surround the airway to help the airway to stay open when we inhale. People with sleep apnea, if you have it, typically have a more collapsible airway than people that do not. Statistically, that airway is also half the diameter of someone that does not have sleep apnea. So when we are talking about sleep stages, how does that work? Just under awake, like we are now, is another stage of awake, and your brain is still engaged. Below that, we just wouldn't have a conversation. Below that, there are two stages of lighter sleep. The average adult spends 50% of the night in these stages. Think of them like junk food. You get enough calories to stay alive, but it's not very nutritious. The next stage would be N3 or slow wave sleep. This is when our bodies are replenished. My grandson was not getting enough growth hormone. Slow wave sleep is the stage where they get growth hormone. And now that he's been treated, he's starting to grow and he's doing quite a bit better. The last stage of deeper sleep is called REM. Most people have heard of rapid eye movement. And this is when the diaphragm works, but the other muscles do not, so we don't act out our dreams. This is mostly a protective mechanism unless you have sleep apnea. REM sleep occurs for the most part in the latter half of the night. During that time, you have no muscle tone to support the collapsible airway, so it may act like that straw in the ice cream sundae we described earlier. For this reason, we see most commonly people having strokes, heart attack, and sudden death, and it happens between 2 and 6 in the morning. That's the time when we have more of the REM sleep. If you have a heart condition and have a sleep apnea event, it may be hard for you to come out of it and you may not survive. What exactly happens when we have an apnea? This is your fight or flight response. That's what kicks in. We're not getting oxygen, the brain is aroused and activated, the sympathetic nervous system goes off, and we release adrenaline. By the way, if you happen to wake up in the middle of the night and can't go back to sleep for a while, it may be because it takes adrenaline a while to dissipate. The fight or flight response brings you up to a level of awareness that your brain can now re-engage, and therefore the muscles are reactivated, the airway will now open, and the diaphragm that can't do it by itself now has the help it needs, and you start breathing again. This process of awakening is enough to open that airway. However, you have to start the process of the sleep stages over again, from awake to lighter to deeper sleep. With each apneic event happening multiple times per hour, this process repeats. This is called sleep fragmentation. It leads to so much more time in lighter sleep and much less time in deeper sleep in the replenishing stages of slow wave sleep and REM sleep. The result of this is a decreased quality of life. Poor sleep by itself can cause weight gain, changes in the way we process sugars. We tend to crave foods with higher calories. Decreased slow wave sleep can cause us to have more body aches. We don't feel as good. The average adult gets 20% of the night in that slow wave stage. Older adults get less naturally. At my age, I'm lucky if I get 5% of the night. With sleep apnea, you may have a diminished amount of time in slow wave sleep or none at all. Note, fit young females can often be misdiagnosed with fibromyalgia. It may be that their aches and pains are due to lack of sleep from this fragmented sleep pattern. A decrease in REM sleep affects memory and our ability to work out the issues of the day. This can lead to a lack of focus, increased accidents, anxiety, or depression. Your spouse also may be affected by this in these same ways because they often wake up when you do during repeated apneic events, when you stop breathing, or just from loud snoring. Other signs and symptoms you may see include TMD, the temporomandibular dysfunction. Young females are most frequently seen within this category. Chronic fatigue or excess daytime sleepiness, mood disorders like anxiety or depression, acid reflux from respiratory effort during those apneic events. The diaphragm can pull up stomach acid, and typically this is seen at night or first thing in the morning. Nocturia, this is when you get up frequently for bathroom visits. All these are related to OSA. Morning headaches due to oxygen desaturation or posturing your head by elevating it so you can breathe better while you sleep. Headaches typically will occur from this in the forehead and last for about 2 hours in the morning. Insomnia is another sign. It is seen frequently. Most people with sleep apnea have sleep onset in less than 15 minutes, but my average patient is much sooner than that. People with sleep apnea may have trouble going to sleep, subconsciously knowing they're going to be in a fight. Or they may wake up, as I said, for no reason between the hours of 12 and 6 in the morning. They're wide awake for long periods of time and they're unable to return to sleep. If you think you have sleep apnea, there are many reasons to be concerned. Sleep apnea is statistically linked to bad comorbidities such as hypertension, high blood pressure, stroke, heart attack, sudden cardiac arrest, atherosclerosis, that's hardening of the arteries, AFib, diabetes type 2, dementia, Alzheimer's, erectile dysfunction, sexual dysfunction, low libido, and oxidative stress, which is a scientific way of saying aging, especially the skin. I will stop here with this overview of sleep apnea and primary snoring. My assistant will be in shortly to talk to you about your experience with OSA or snoring and to gather some additional information. After that, I will be in to see you. We will continue this with more about oral appliances, how they work, how they compare to CPAP, and what they look like. I will try to answer all your questions and if at that time.